Okay, so welcome again, everyone, to Bell Global Justice Institute's CSW 68 parallel event. I'm very excited that you all are here. We're live streaming on Facebook. We are recording this session as well today, and it will be available later for everyone to watch again. We will have a chance at the end for question and answer, where we're going to talk with our dynamic speakers. Before we do that, well, let me just say hello to everyone. Hi, Tamika. How are you? Tamika Sitch and Spruce. Tamika is a disability rights activist and an independent filmmaker. And we have Miss Tamika Jackson from Mothering Justice. Hi, Tamika. And then we also have Pamela Alexander from the Women in the NAACP. Hi, Pamela. We also have Sharon Fincher from Avalon Healing in Detroit. And then we have Jamie Jr. Hi, Jamie. Jamie is a disability rights and socioeconomic justice activist. I want to welcome you all. Very excited to talk with you. And so I'm going to share my screen because I want to share some important information about Bell Global and the focus of our talk today. So just give me a moment. Can everyone see this screen? Okay. Let's see. Okay, so I'm also admitting people at the same time, so so I'm a little multitasking. So welcome to Bell Global Justice Institute. A little bit about us. We are a 501c3 tax-exempt organization. We are in special consultative status with the United Nations Economic and Social Council since 2022. And we work to inspire, empower, build, and mobilize strong voices and impactful actions to advance and preserve the human rights and human dignity of women and girls globally. And so we do our work through a series of ways, a series of different ways. We work through an intersectional gender lens. We do awareness campaigns, trainings, we do advocacy. We particularly like to connect the local community to global mechanisms. And so we are of support of the United Nations Sustainable Development Goals and of the international human rights system, framework, and its mechanisms. And this is something that we have been doing since 2016, so we're celebrating our 8th year, which I am very excited about. I started this organization in honor of my brother, Staff Sergeant Vincent James Bell, who was in the Marine Corps. He served for 10.5 years. He served 5 deployments. He was killed in Afghanistan in 2011. And we dedicate our work in his honor. And our work is guided and informed by our commitment to respect for human rights, human dignity, inclusiveness, equality, and social justice. Here's a picture of him in Iraq in 2007, where a little dog named Riley wandered onto his base. And so that's Riley. So. Of course, you all, I'm sure, have been attending other sessions within the CSW realm. And but just as a refresher, the priority theme for this year is accelerating the achievement of gender equality and the empowerment of all women and girls by addressing poverty and strengthening institutions and financing with the gender perspective. So our focus today, we're going to talk about the interconnected ways that poverty and health inequities impact the quality of life for women and girls. We're going to be focusing on 4 areas. That is Black maternal health and infant health. We're going to be focusing on gender-based violence, period poverty, and disability justice. and within disability justice, socioeconomic justice as well. And we have a fabulous panel of gender equality, equity, human rights activists who will speak on these different areas. We'll also be speaking from a lived experience as well. And we're going to talk about some best practices in ensuring that we focus on these issues, particularly around the lives of Black women and girls. And then I want to take a moment for us to reflect on a very powerful young woman from Detroit, Michigan. In January of this year, we lost a wonderful woman named Kelly Ann Mays, known to us in Detroit and around the world as Native Child. She was unfortunately killed due to intimate partner violence. Kelly was a Black and Indigenous mother, daughter, sister, friend, poet. She was an activist, domestic violence prevention advocate, and mental health advocate. And this has been a huge loss to the Detroit community. And I would like for us to dedicate our session and our talk today in her honor. And I would like for us to also take a moment of silence in her honor. Thank you. And this is for Kelly and for all women and girls around the world who have endured gender-based violence. So we love you, Kelly. Okay, I'm gonna stop sharing now, and we're gonna go ahead and get into our discussion. And while you're entering the room, please feel free to say hello, let us know where you're from. Later, we'll be taking questions towards the end. And if you want to add questions in the chat during that time, that'll be okay as well. So I think what would be good is if we start, I'm going to start out with each of the speakers, but before we go into questions, I'll have each speaker just say a few words about themselves. I know that if you've been on the CSW forum, you will see their bios. I can also post, probably post the bios later on our website as well, but I want to give everyone a chance to kind of say a few words before we go in. So we're going to start with Jamie. Jamie is our first speaker. Hi, Jamie. How are you today?
I am well. Thank you so much. I am so pleased and honored to be a part of this event and a part of this wonderful, powerful panel of women. Just a little bit about myself. First, I'm going to introduce myself in an equitable manner. My name is Jamie Jr. I am a light-complected woman. I'm wearing clear glasses. I have long locks. And behind me is a background with a blue, kind of a bluish grayish wall and what looks like a floor. And I'm wearing an orange and white shirt. I try to, if I can remember, I try to do that as much as possible because part of my work, part of my advocacy, part of my activism is creating access, full access and universal access. So that's my first introduction into this space. Also, most recently, I have had the privilege of being crowned. Well, for last year, I was Miss Wheelchair Michigan. And people have mixed emotions about Miss Wheelchair Michigan. On one hand, people think it's great. On the other hand, I've heard comments and seen comments of, why Miss Wheelchair? Why celebrate that? So just as I celebrate the fact that I'm a woman, just as I celebrate the fact that I am a Black woman, I celebrate the fact that I have a disability because it's all a part of me. And I was honored that I was able to be in the space of representing people like me in that way. So I honor myself and I honor that title in that way. Also, my day-to-day work is around accessibility. I work as a ADA coordinator and a peer advocate for individuals. So that's all about creating space and opportunity and access. So it all encompasses creating equitable access for folks, and that's me.
Jamie, thank you. Thank you for kicking off our panel in such a very strong way and powerful way. We just in and I'm already in tears. Thank you for your wonderful introduction and congratulations on being named Miss Wheelchair. I think that's just a beautiful honor and I appreciate you. And so, yes, as an activist and as a person living with a disability, could you please share more with us about your work as a certified ADA coordinator and as a member of the Michigan Developmental Disabilities Council?
Sure. To really understand, well, I'm gonna say the way that I understand my role as an ADA coordinator is a person that facilitates access. And in my view, access is more than just a one-dimensional thing. It's like people, we're four-dimensional. We have to be able to physically access a space, emotionally access the space by feeling comfortable, welcomed, and included in those spaces. So the Americans with Disabilities Act did a good job of creating a legal framework for that access. Unfortunately, we can't legislate people's attitudes. We can't legislate, backlash. So in that way, I see myself as a facilitator of that access and creating a space for people to understand it better, and understand their rights. As the vice president of the Developmental Disabilities Council, they coincide because the Developmental Disabilities Council is a strong legislative liaison body that helps to create space and programs for people with disabilities. And in our work, we primarily focus on those who have significant multiple disabilities. And that means that people have to access multiple systems to get what they need. So imagine a person who, like myself, uses a wheelchair, may also have difficulty communicating either in multiple ways. They have to access multiple systems to get what they need. So we prioritize those folks in our programming and in our advocacy, because we know by creating a space for individuals who have the hardest time, we create a space for everyone.
Thank you, and that is really important. I live with a disability myself, and having access and ensuring that spaces are inclusive is really an important component of honoring the dignity of all and uplifting and advancing the human rights of all. So I appreciate your work, and can you share with us in your view the ways in which poverty and socioeconomic status and disability are linked, particularly for Black women and girls living with disabilities? What are you seeing?
So I see them linked in a cylindrical process, meaning that one directly affects the other. Socioeconomic status doesn't just include income, but it includes education, it includes class and gender and race. Of course, we know these things. And historically, people of color, women, have had difficulty accessing equitable education. We are historically paid less than our male counterparts and of our white counterparts. So in that way, disability adds another layer of stigma and difficulty in accessing those services. So yeah, that's how it's linked. And it's important that we create spaces like these. And thank you, Leonard, for really lifting up how very important addressing social economic status is, because if we don't acknowledge it, then we also have a hard time creating social safety nets for people. People fall through the cracks because they don't have that all-important access, or they're locked out of healthcare, of education, of things that they need to live an everyday life to feel a part of human society and feel like they are a person who deserves dignity and respect.
Yes, 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 indeed. Yes, indeed. I was on a panel about a month ago, and I had looked at some information on the CDC and saw that 36% of Black people living with disability in this country are living in poverty. And so disability and poverty are so closely linked. Many people living with disability who are receiving Social Security or other forms of assistance have to live with someone else because they can't afford housing. Food prices have gone up, and so yeah, disability in addition to other intersectional identities does add another layer for folks. So I appreciate your answer. And what societal changes must happen to ensure people living with disabilities are able to live independently, including financially and with dignity?
The largest thing in my estimation is attention needs to be paid to the fact that these inequities exist. There is research that shows that an adult living with a disability has to spend about 28% more of their income on basic needs or on disability related expenses. So in acknowledging just that fact, we understand that it's difficult for people. People are in perpetual states of poverty because in order to qualify for help that is needed to live every day, particularly when you live with a health condition or a disability, you have to be impoverished to do so. That's another way that we can create space for people to live with dignity. Think about increasing benefit amounts. Think about increasing caps on savings so that people are not forced to live in a cycle of poverty and crisis that traumatizes them over and over again.
Yes, yes. Because anyone who has ever lived in poverty knows, number one, how expensive it is to be poor and how stressful it can be and can add layers to a person who is already sick and struggling. So thank you. And then how can allies advocate for more inclusive societies?
We can allies can continue to create spaces that leave room to have the conversation and make sure that people who are impacted by these things are in position to not only voice their opinions, but contribute to in a real way to equitable change. Those are the most important things.
Thank you so much, Jamie. I really appreciate you and your expertise and And I do look forward to working with you even more. We have so much work to do together. And did you all know that there are, in the world, according to the UN, there are more than 1 billion people living in the world today with some form of disability? Think about that as we go further into our conversation. And we're gonna now switch over and talk about gender-based violence. At the beginning of our talk, we held a moment of silence for a dear Detroiter, Kelly Ann Mays, a Native child. And I wanted to, in our session, include the role of gender-based violence and poverty and how they intersect. And so I'm really excited to bring on Sharon, a good friend. And Sharon works for Avalon Healing Center. And so Sharon, you want to tell us a little bit about yourself before we go into our discussion?
Sure. Hey, everybody. Thanks for having me, London. This is amazing. My pronouns are she, her, and hers, and I was born and raised here in Detroit, so I'm definitely a Detroiter. I identify as a masculine presenting lesbian. I'm associated with two amazing organizations, one being the Ruth Ellis Center, which we'll talk about, and also Avalon Healing Center. That's where I'm employed as the Access, Equity, and Inclusion Coordinator, and I've been there almost 7 years now. So I'm excited to talk today.
Thank you. Thank you for all the work that you do. I've seen you in the community, so I appreciate you. And so can you tell us more about your work with Avalon Healing Center and your work within the organization?
Yeah, so like I said, I've been at Avalon for almost 7 years now. We actually just moved into our own space. So we are a sexual assault advocacy organization. And this building, it's a beautiful building, pretty old building in the city of Detroit, 601 Bagley. We are a one-stop shop, all comprehensive organization for survivors of sexual violence. That will not just primary survivors who are people who are directly affected, but also the families and the loved ones and the community of sexual assault survivors. So what we offer are medical services. We do 24-hour exams. So if someone is assaulted, we have now 6 sites, including our own building, where our forensic nurse, along with an advocate, goes to meet with the client. And, we kind of advocate for that client and talk to that client about what they want to do, and let them make choices in this process and complete the forensics exam with them. With our medical service, we also have a follow-up clinic. So you don't necessarily have to go to your doctor and say, hey, this happened to me, because it's very traumatic to have someone to keep repeating that story. And so we already know what's going on. You're already affiliated with us. So we have a wonderful team with Glenda and Michelle, and they run our, excuse me, our follow-up clinic, where they do STI testing and a whole host of other things to try to help survivors, along with providing medications. Then we also have our counseling services, where we have counselors. So some people prefer methods where they can actually sit with someone and talk. So we have counselors to provide that support, and also a youth specialist who works with our youth, but also incorporates art as therapy with her program. And then, of course, we have our advocacy, which we help with, clients being able to explore their options. We accompany people to court. We accompany people to local police stations, and we also assist with helping people complete PPO orders. I am part of what I'm hired to do there specifically was to work with underserved communities. So all of the things we talking about kind of fall under the umbrella of what I do. And I'm also developing our DEI program to make sure that our programs are more diverse, equitable, and inclusive within the inside of Avalon. And with all of that I do, I'm part of our education and outreach team. Look us up, Avalon, avalonhealing.org. And we also have a wonderful podcast. Our director of communication, along with myself, are hosts, and it's called Voices Through Avalon. You can find us on all of the streaming areas.
Outstanding, outstanding. Thank you. And would you like to share a little bit also about the Ruth Ellis Center, which is also doing extraordinary work locally?
Yeah. Wow. So the Ruth Ellis Center, my baby. Hey, Pam. um, The Ruth Ellis Center is one of a pretty large organization. We've been around. Actually, this is our 25th celebration year. Been in existence for 25 years this year. Named after our namesake, who is Ruth Ellis. And if you have time, anybody, she has a documentary out there, Phenomenal Woman. So I think that was the perfect name for the center. But what we do is we provide services for LGBTQ youth from the ages of 13 to 30. We've recently opened up our Claremont Center where we provide supportive housing, long-term housing for individuals needing support, where they can actually get, health care, can also get mental health services. It's an art therapy program over there as well. We have our drop-in center, our institute, and a whole host of other things. So definitely, when you get time, you definitely want to check out ruthelliscenter.org. We would, appreciate anybody that would like to take a look at that as well.
Thank you, thank you. And in the area of gender-based violence, can you share with us some of the risk factors for people who may be vulnerable to gender-based violence, particularly within the LGBTQ plus community?
Yeah, so within the LGBTQ plus community, I mean, you have to think about all of the things that gender-based violence creates in addition to. So we'll start with just the basics. And it's just so many things with gender-based violence. But one of the things, and thank you for mentioning this earlier, socioeconomic class. Not to say that gender-based violence is not a problem everywhere, but it's definitely a problem with gender-based violence. And with gender-based violence and socioeconomic problems, you have a problem with accessibility. And so there's healthcare, there's schools, there's resources, there's having police departments that are not burned out because of high crime rates and things like that. So we know that all of those things are important when we're talking about gender-based violence or socioeconomic class. So when we live in a society with so many pressures and things like that, and then we put socioeconomic class on top of it, here we go with the norms and the toxic masculinity, all of the different things that we experience in the sexual violence and the domestic violence and the intimate partner violence. Because of the pressures of the socioeconomic classes and everything else, those types of problems become bigger. Keep in mind what I said is access to. So where in more affluent neighborhoods, we don't hear about this as much. That's not to say that it doesn't happen. We don't hear about it as much. And one of the reasons for that is accessibility. And in impoverished neighborhoods or neighborhoods or, communities with socioeconomic class, and that's not just in America, I mean, just globally. Let's just look globally at this. There is not a lot of resources. There is not a lot of resources for people to go get things to help with them, okay? And so now we get to the LGBTQ community. That is another layer of oppression and another layer of things that are just sometimes canceled out for people. And that could be family support and support at schools and medical care. So we mentioned medical care just, for cisgender or heterosexual people, or as Jamie mentioned earlier, trying to get good health care for people with disabilities. But then you have health care for people where the medical community is starting to become a little bit more open to even understanding the healthcare needs of LGBTQ people, transgender people, non-binary people, and all of those types of things. And on top of that, we live in a pretty harsh society, right? We're a very judgmental society. And so where if this extra layer of being an LGBTQ person wasn't already hard for me to try to get community support, that just really limits my chances of trying to get any type of support. And so you find people that gravitate to people that may want to help them, or so they think, right? Because you're looking for family, you're looking for a community. And then we get into things where there's abuse with LGBTQ children, LGBTQ elders, LGBTQ people with disabilities. Definitely economic abuse is also another layer of that. So, those are the things that I believe are impactful with what you asked in your question.
Yes, thank you. That is very comprehensive and I appreciate, how you laid it out. And I think it's important for us as allies to think about ways in which we can create safer spaces, more inclusive spaces, particularly for survivors of gender-based violence. And with you touching on the ways poverty and gender-based violence within the community are linked, in what ways can communities work to protect the dignity and security of survivors of gender-based violence and their families, including from an economic perspective?
Well, I think one of the things that we all have to realize is violence is inflicted highly on the vulnerable people. And so I think we have to acknowledge, who and what vulnerable people are so that we can offer extra support to them for, for those types of things. So let me see here. I'm sorry, I'm getting my notes out.
Okay, that's okay.
Let's see here. So some of the things that communities can do is one, acknowledge and believe. I think when we talk about gender-based violence, especially if it's a loved one or something like that, and they come to us, we have 50 million questions for these people because we want to try to understand. But in that moment, you have to understand this is totally not about you. Offering support is the biggest thing you can do. So definitely believing them. As far as community education, I think community education is great. Community education would include businesses, churches, schools, libraries, law enforcement, hospitals. There are a lot of people in the communities that want to do something. They just aren't really sure what the something is. As an advocate, I always go out in the community and I talk to people. I try to figure out what their strong points are, what they're interested in, what I feel like they would connect with. And then I try to give them somewhere or give them to somebody that they can be helpful in some way. It could be the people at the gas station. I've always found it useful. The people at the grocery stores want to donate. You'd be surprised how many people want to help. Investing back into the community, I think, is very important. Even when we're talking about gender-based violence and socioeconomic class, we have to understand that all of these things are tied together, right? If I'm investing in my community, that means I care about my community. I care about what goes on in that community. And so I'm paying more attention to that community. I'm more conscious of the safety concerns of that community because it's mine, right? And so if we invest back into our communities, that's going to help make those communities stronger. I think providing resources and education for the communities. There are a lot of conversations that people shy away from because they're uncomfortable. But I always say this, uncomfortable conversations create change. And that's just the only way that we're going to be able to do that. I think that supporting communities or businesses that are already in the community is important. Community-owned businesses and promotion of community-owned businesses, I think, is also important. And then provide trainings to community members to learn various skills. We don't always have to outsource. I think we, as a community, and I don't mean just here, I mean everywhere, come from people with so many different resources and ideas and everything and things to offer that I just feel like if we come together and just train each other on some things, that would help with a lot of things too. So I think that those would help with gender-based violence because we as a community can be aware, have some trainings on bystander violence. So when you see something, you don't necessarily feel uncomfortable, but you know a healthy way, you know what I'm saying, to help solve the situation. And I just think those are ways that would help community and socioeconomically. Strengthening that community within the inside definitely will help that community stronger socioeconomic wise.
Yes, I can't say anything more. I think your answer is perfect. And it's reaching broadly because I want to say we have someone here from England. We also have someone here from Zambia in Africa. So it's really important that you're here today, Sharon, to give your expertise because it is wide reaching. And so I'm looking forward to the question and answer session later. Thank you. I appreciate your time. And so another area of health that is very, very alarming here, particularly in the United States, is around maternal health and Black women. And I want to talk with Ms. Tamika Jackson, who is here today. And she's going to tell us a little bit about her experience, her story, and her work. But first, Tamika, I would love for you to tell us a little bit about yourself, I know you with Mothering Justice that's also located in Detroit.
Yes, hi, my name is Tamika Jackson. I am not native to Detroit. My family, like my mother and her brothers and sisters are from Detroit, but I was raised outside of the city in the suburbs. Luckily, with access with programs, we were able to have a decent education. But I definitely through stories from my family and through some of the experiences I had, my mom was battling mental illness. I really started to look into the lack of resources that exist inside of Black communities and like why that is. You know, our communities aren't like this because it just is. This is a created situation. Divestment is real and it impacts people on so many different levels. Um, so that's kind of what drove me to get into the work. I obtained custody of my sister at a really young age. I was about 20 and she was 11 years old. So that was my first real experience with being a parent and trying to navigate the system, especially as a Black woman. It was extremely eye-opening about a lot of the disparities that existed. And fortunately, you know, we made it through. But I became a mother to my own son in 2022, and it kind of brought me back into the work because of some of the things that I have been experiencing. And I have been doing grassroots work for many, many years around like the housing crisis and, you know, fair wages. But Mother Injustice is a political advocacy group that really helps educate the community around what we can do to impact change on a policy level. Like, how do we put forth changes that will center Black, brown, and indigenous women and our families, especially because if we don't have policies that are focused, that aren't specific, then they won't impact and help everyone. And actionable steps. Thank you. um, But we do this at Mother and Justice through our Mama's Agenda currently, which focuses on affordable childcare because, like many parents know, childcare is not affordable. Sending one child to daycare is as much as rent for a one-bedroom, two-bedroom home. I don't even know how folks with multiple children are affording to be able to send their children to daycare and then still work and pay bills. We focus on paid family leave. We have FMLA. It's great. It keeps us from losing our jobs. Um, you know, it gives us the time off that we need, but financially, people are still losing their homes. They're not able to get the type of care that they need as long as they don't have any type of income coming in while they are on paid leave. So they're on leave. So we're looking to change that and expand it to paid leave, because that is something that we definitely need, especially after having a global pandemic. I don't even know why this is a question, but it is.
Yeah.
We focus on basic needs, and then of course, yeah, mother justice, reproductive justice, and Black maternal health, which is where I reside.
Yeah, yes, yes. And so you are the reproductive and Black maternal health organizer. And also before I go forward, I did put the names of the organizations that we've been talking about, and I will send an email with all of the links to all of everyone who's registered. So you'll have that information. So don't worry, that information will come to you. Yes, so Tamika, you are the Black maternal health reproductive and Black maternal health organizer for Mothering Justice. Could you share a little bit about your own, and you began to share about your own lived experience. Would you like to share a little bit more about your own lived experience?
Yes, so I am a first-time mom at the ripe old age of 38, ripe young age. And I wasn't expecting it to be like the easiest pregnancy, but my pregnancy was pretty easy breezy for me to be considered a um they call us geriatric pregnancies. I didn't have any issues, no underlying conditions. My baby grew great. I made it all the way to 39 weeks. I went in for my 39-week checkup and my blood pressure was slightly elevated. So they decided, let's go ahead and induce. Let's not risk it. At that point, I'm like, okay, my team is really trying to work with me and protect me and my baby. So I went in for my induction. It took a couple of days to really get things progressing with the labor. But when things started to progress and my contractions started coming more often, I had decided to opt in to get the epidural. It's explained to me, it's a blind injection, they'll put it in this, T part of your spine and pretty basic, these are some of the run-of-the-mill issues that may happen, but for the most part, it's a pretty safe procedure. So when she placed the needle in and she asked me, how I was feeling, she said I should feel tingling in my legs. And that's not what I felt. The first thing, as soon as I felt the medicine come in, I felt like this whoosh come over me. It was almost like I was gonna tip over, and I'm like, I don't feel tingling in my legs. I'm feeling it all in my head. And I'm telling her, I'm like, something is wrong. Something isn't right. And so it starts become harder to breathe, harder for me to hold up my head. And I'm looking at my nurse and I'm telling the anesthesiologist, like, I cannot breathe. And her first reaction was, this is what she said. She said to me, if you couldn't breathe, you would not be able to speak. And so that was very alarming as it's getting harder and harder for me to breathe, that this woman doesn't believe me. This is a problem. And I'm scared. I'm pregnant. I'm scared. I'm slowly like losing my ability to breathe. And my nurse, though, I'm holding her so tight and I'm like, please do not lay me down. Please do not lay me down. And it's getting harder to breathe. And so she called in more nurses. And as the other nurses are coming in, they're like, what's going on? And granted, my nurse was the only Black nurse in the room that I had. Thank God for her, because she saved my life. And as the other nurses came in, they're asking, like, what's going on? And the anesthesiologist is just like, she's just having a panic attack. Like, she is literally downplaying what is happening. Like, this is just something that's never heard of. But long story short, I went into complete respiratory failure and I coded. I had to be put on life support while I received an emergency C-section. And I was able to be revived not too long after that. I had to spend the evening in the ICU, so I didn't get to have my baby.
Mika, I'm so sorry.
I'm sorry. But just having the nurses coming up to me as I'm waking up, rolling down the hallway was, your baby's so beautiful. And I'm like, well, can I see him? And because I was in the ICU, I could not keep him. He had to stay in the NICU. So I got to see him for just a moment. As the doctors explained to me, what happened, that she had put the epidural too far up in my spine and it shut me down completely up instead of down. My biggest question that no one could answer was that if this is something that could possibly happen in the procedure, why did she not believe me that it was happening? Why did she delay my care? Like, why did I have to go into complete respiratory failure for you guys to be like, oh, she's serious. Like, there is something wrong. Like, I shouldn't have to suffocate to death. I shouldn't have to beg for my life and my baby's life. And we are so lucky that I don't have any long lasting damage. And so far, so good. Nothing for my baby. And throughout my postpartum care, like, this is something that definitely had a heavy mental toll on me, but it did not break me. And I started to think to myself, I started to tap into my old organizing roots. And I wanted to know, like, what can I do? What work needs to be done? This should not be happening, because this isn't like I had an underlying condition or some type of pregnancy complication. This was a mistake made by another person. And then once the mistake was made, you know, the fact that I couldn't just be vocal and I'm advocating for myself, and it literally, there was nothing, I was helpless. I was truly helpless in that moment in a very vulnerable situation, especially when you're having a baby. And because of the preeclampsia, I was on a magnesium drip, which reduces your ability to walk. So I was totally at their mercy. I couldn't even get up and walk out of there if I wanted to.
Wow.
But that is what drove me back into the work and why I do the work that I do.
I need to thank you for your courage in sharing your story today. I'm so sorry that that happened to you. And I think I can speak for everyone when I say we are so happy that you are here, that you survived, that your baby survived, and you know, that you're in this fight. We need you. And so thank you for sharing your story again. I'm very grateful. And you know, with your experience and what you've seen at Mother Injustice, what are some of the root causes of the high rates of maternal death among Black women in the United States? And how would you say that poverty is a factor? What are you seeing?
Okay. So as far as poverty comes into play, you know, we're going to talk about those socioeconomic factors like inadequate insurance coverage and lack of access to quality care. Or we could talk about the chronic illnesses like diabetes and hypertension and obesity, but all of these things are directly connected to poverty, like having to be on state coverage. Like a lot of patients, and this is something that I didn't know, that having Medicaid, you know, to me, I'm thinking, you know, insurance is insurance, whether I'm paying for it through my job or getting it through Medicaid, like, but it is not. It is very, very different. And the process, the low pay that comes from Medicaid, and not only the rigorous process that they make providers go through to even receive their reimbursements, they make it undesirable on purpose, which limits how many providers are available to us, which in itself really cuts us off with access to be able to really pick out the type of care that you want to get. It's so limited. And then you have some places that are trying to address it with programs, but if you didn't pick the right provider program, if I'm under Medicaid and I picked HAP instead of Molina, but it accepts Molina and not HAP, why isn't it accepting all Medicaid?
Yeah.
Like if there's programs that are created that are supposed to be aimed at helping women who are experiencing poverty or families, and they literally don't work, like it's a design, but it definitely contributes to poverty in so many ways. And then when we talk about the chronic illnesses, sorry, the chronic illnesses like hypertension and diabetes and obesity, like a lot of communities our color are in food deserts.
Yes.
They're in food deserts, and the grocery stores that exist do not have fresh meat or produce. We don't have access to like quality, actual nutritious food. Like you could go to nutrition, they can say eat like this, eat like that, but there could be so many different things. I don't have a car. I could be dealing with mental illnesses. I could be dealing with chronic physical illnesses. Like it's not that simple. And then when you do want to go to those nicer grocery stores, like the prices, it's unaffordable. I mean, if you're somebody who's living at the poverty line, which a lot of us are,
Yeah.
a lot of us are, like, that's just not realistic if you have other mouths to feed besides yourself, especially when you already have children.
Yes.
So that is a big, big problem. But the biggest issue that is leading to Black maternal mortality and morbidity, it is racism and sexism. Like structurally, it is. It doesn't matter your socioeconomic background. You could be rich.
Yeah.
You could be powerful. Like Serena Williams showed us that. You could be famous. You could be loved. It does not matter. When you go into that room, you are just a Black woman. You know, the sexism part comes into play where people think that women are over exaggerate things. You
Mhm.
know, that's where it's like, oh, when a woman says something, oh, she's just probably the exact same way the anesthesiologist treated me. Like she's just exaggerating. Like there's nothing wrong with her. She's having a panic attack. Like these are the things that are not just delaying our care, but it's killing us. It's killing us. And this isn't an underlying condition or anything. Like, this is literally just biases. Like, someone's opinion of me is going to decide whether or not me and my child make it out of this hospital whole.
Yeah.
There's no place for that in healthcare. So we need options.
Yes, absolutely, absolutely. And then, from your perspective, what types of policy changes must happen to protect the health of Black mothers and babies before, during, and after birth?
The biggest policy changes that will impact it, like, yes, we need bias training for medical professionals, but we need access to alternative options for care, like doulas and midwives. Like, they are crucial in creating like cultural competence. And this is something that doesn't have to just exist outside of the hospital. Like, it can exist in tandem. You can still have an OBG and have your midwife or your doula there. And they are able to come to your home. They are able to provide a service that hospitals have not figured out how to provide to pregnant persons. Like, your doula, they can check on you throughout your prenatal and in your postpartum period. These are things that aren't offered through our healthcare system, but they can also operate as an advocate for you in that room, which is a big difference for us when we're trying to just battle the biases. Like, not even like the physical issues or what might be happening with our bodies during labor, but literally having that advocate in there, because the patient advocates at the hospital, they decide when you get a patient advocate, if you're going to get one. Like, this gives the power back to you to be able to decide like what type of level of care that you want. And so we need to see more, we need to see more funding. We need to see more acceptance. And yes, we do need that bias training happening and representation across the board, but it's definitely not enough. We need a birthing center. You know, we need to, if the hospitals, if you guys can't handle us coming in, because even when I was there after all that happened, nurseries are closed. I have to recover from you murdering me, and then I have to keep the baby too. Like, there is no nursery for for my baby to go to. So that was another issue, and we need alternative options, and we can create the funding for that. Like, all the funding that's going here, we could be putting it into this. And doulas, doulas and midwives, they are individuals that don't belong to a healthcare system, so they can accept whatever providers they want to, like, this is something that is, and their work is focused on community. Like, that is their function, is to strengthen and their community ties. So a lot of times when midwives and doulas, they will be regular community members that are right there in your neighborhood, and they will come to you and see you throughout your pregnancy. You don't have to go in for those all I can call them is conveyor belt um appointments, where you just go in for 5-10 minutes just for them to be like, oh, your baby's okay, you look okay. Not any real care, just so they can bill your insurance. Like, there needs to be alternative options, because the care that we're receiving is not leading to the betterment of our communities and the survival of our families.
Thank you, Tamika, so much. You have really enlightened all of us. And I am very grateful that I know that people will have questions for you later in our program. I just want to just say right now that I really appreciate you and all you do.
Thank you.
And so now we're going to, along with talking about disability, gender-based violence, talking about Black maternal and infant health. Period poverty is also an area of concern. And I'm happy to welcome Pamela Alexander. Pamela is the chair of the Women in the NAACP for our branch in Macomb County, the WIN. And Pamela was also the former president of our Northern Macomb County branch of Now We Are Macomb County. And so, Pamela, you have 40 years of experience in human services and administration. I'd like to share a little bit about yourself before we go into questions.
Yes, thank you for that introduction, London. And so, as London mentioned, I am like 40 plus years into working in the human service field. I retired a few years ago, but I continue my work in working in communities as an advocate now. And so as London mentioned, I am on the NAACP Macomb County branch, and I'm the chair of the women's program. And so I just have always had a strong interest in women and girls, making sure that they had access to the things that were needed for themselves in their lives. And so a lot of the work that I've done over the years has been in support of women and girls. I've worked with different populations, but certainly women and girls. And so with that being said, a few years ago, I took an interest in this term called period poverty. And so after reading and researching about it and then, going into the community and learning more and sharing more about this issue, I really believe that a lot more needs to be done to make sure that women and girls have access to the hygiene products that are needed.
Thank you, and with that, can you share with us what is period poverty, and who is generally most affected by period poverty here at home and around the world?
Okay, thank you for that question, London. Period poverty is a term used to describe the lack of access to adequate menstrual health management supplies and education. Period poverty refers to being unable to afford products such as tampons, sanitary pads, and panty liners. Based on research from the University of Michigan School of Public Health, as just a data piece here, 1 in 5 girls, teenagers, miss school every day because of lack of the menstrual products that they need during their period. And at this time, it is certainly somewhat of an epidemic, not just within, globally around the world, but it's a problem here in the United States as well. Globally, of course, 3.5 billion women have monthly periods, according to the charitable organization for girls. Over 500 million women and girls, nearly 25% of all menstruators, experience period poverty. Over 500 women and girls do not have access to feminine hygiene products. So with that being said, you have to think about the experiences of girls and young women as it relates to, what do you do? What can you do if you don't have these resources? I thought about my own childhood and teen, preteen, as I entered into my administration monthly. My first experience, of course, when I shared it with my mom, that I thought that my period had started. And mind you, this was 60 years ago. She really didn't have the products at that time. And so she taught me how to use, parts of pillowcases that she would cut up or material that she would have. And so for me, that was kind of the introduction. And what makes me sad today, some 50 plus years later, it's still a problem. It's still a problem in this country and around the world. So, using rags and paper towels and toilet paper, anything like that is very, very unhealthy. So some of the work that I do is that I talk to, go into the community and talk with school administrators and other community organizations to address this issue for girls and young women.
Thank you for that very comprehensive overview. And what are some of the devastating consequences of period poverty for girls? I know, there are parts of the world and even in the United States where access to water and sanitation is difficult. So what have you seen are some of the devastating consequences?
Well, first and foremost, it can be a foundational cause for girls and young women to experience depression, levels of anxiety because they don't have access. It also interferes with them socially, with going to school is problematic as well, and I think we really got an idea into, rather insight into young people having problems around the depression within, COVID, the pandemic. Okay, with that being said, girls being able to have to stay at home because they weren't able to go to school, and then having their their monthly menstruation, and then of course limited resources to get out and get access to that. Those resources really did cause higher levels of mental health problems for girls and teens and young women. But overall, as it relates to looking at the intersectionality and how that overall impacts girls and women, really it comes down to this. And when we talk about period poverty, we should keep in mind that all administrators are not women, and not all women who menstruate, women are menstruate. And so what that basically means is that there are trans men, trans boys who menstruate, okay? And then there are women, trans women who identify as women, and yet they don't experience, menstruation. However, the products that are generally labeled in stores refer to these products as feminine products, which isolates and dismisses the identity of women who identify as women, and for those who menstruate.
Yes, absolutely, absolutely. Thank you. And I'm seeing here in the comment, Ruby from Zambia, she talks about 3 in 5 girls in Zambia miss school. That's a very alarming number of girls that miss school, and the level of shame that comes with period poverty can be life altering for those who menstruate. And so thank you for, shedding light on this issue. And then how can we end period poverty and ensure all people who menstruate have access to menstrual products and menstrual hygiene education?
Well, first we start with the basics in the home, making sure that families have access to what they need. When young girl starts school, and she starts her menses, these products should be available in schools, all schools across the nation, and hopefully all schools around globally. I also believe that there needs to be policies in place that address issues as to the cost of hygiene products, and those products that are needed by women, because periods are, it's a part of life. It's a part of nature, and so anything that we can make sure that those products are accessible for families, for women and girls. And I also believe that removing taxes, the cost of should be addressed as well. And if you did know it, during the COVID-19, there was a worldwide shortage of tampons and napkins and so forth, but no one ever talked about it. No one ever talked about this issue. And even today, roughly speaking, tampons and sanitary napkins have increased, depending on what part of the country you live in, anywhere between 10 to 15%. And at this current time, there's only one company in the United States that produces tampons on the East Coast. So that in itself is a question about supply and demand. And then, of course, we need to make sure that our communities are educated. So increasing those numbers of PSAs, public service announcements about, and we shouldn't shy around or shy about, periods. That's the other thing, using visual and audio talk about the necessity for access, number one, and secondly, to make sure that girls understands what's happening to their bodies overall. And overall, just making sure that people have access. And because right now you can go into a grocery store or a drugstore, and one of the smallest areas in the grocery stores are the period products. And so this is something that's really important to me at this point in time. I know I went through my own experience so many decades and decades and decades ago, but it's a shame that it's still a problem today, and so educating girls, educating boys as well, because both genders need to grow up and learn about the need for these products in our families, our homes, our communities, and our cultures. So
Thank you so much, Pamela. I really appreciate your expertise in this, and I'm looking forward to more work coming from the WIN committee from our Macomb County NAACP branch. So thank you for all the work that you do.
mm-hmm.
And so I'm very excited to talk with Tamika Sitchin-Spruce. I designed the dynamic of this conversation to begin talking about disability justice and also to end talking about disability justice. And so I wanted to, I'm very happy that you're here with us, Tamika. How you doing?
Doing good.
Good, good. Before we go into questions that I have for you, why don't you tell us a little bit about yourself?
Yes, so get Tamika Sitchin Spruce. I live in Detroit area. I am a disability justice activist, independent film producer, and a speaker. And so just a little bit quick about my story. I have a disability, can't tell, but I do have one. I was injured as a baby, nearly 6 months old in a car accident. So I have a spinal cord injury. So I use a wheelchair. And so just growing up, as a, Black girl, brown skinned girl to with a physical disability. And I was born in Detroit, but like Tamika, the other Tamika, grew up in the suburbs. So, I really had to encounter things like racism and ableism and sexism and, all those things that people, like me experience. And so, I got into advocacy of like disability advocacy when I was 21 through Miss Wheelchair. So another Miss Wheelchair uh, winner, represented the state of Michigan. So so through that competition really put me into seeing for the first time other women with disabilities, particularly who use wheelchairs. Like me, I've never experienced that before. So with all those experiences that I had growing up and then get to disability justice and things like that, I really wanted to, advocate and tell stories. And particularly, tell stories and advocate and educate around race, gender, and disability. That's where I tend to put my focus in.
Well, thank you, Tamika. And of course, I'm proud to, call you friend and colleague. And so as a filmmaker and storyteller, can you share with us why it is crucial that voices and stories of BIPOC disabled women and girls are amplified in the media?
Yeah, I think it's really important because for one, is creating awareness, to like the mainstream, to people, to see like what it's like and what are the experiences of, people, with disabilities or, BIPOC women and girls. And, so creating more awareness of the issues, that we experience. But it also, I believe it creates representation. And so, I think representation is important, for our community to see stories that's similar to ours, see characters that's doing things that never seen people be able to do before. I think and that's one of the reasons I did get into, media or wanted to tell stories because I never seen that growing up, any people, who look like me. And I was even told, that I could not enter into, filmmaking or film producing or video producing. I couldn't do any of that because of my disability. So I was actually discouraged. But I kept on because, like I said, the representation able to do was to wrote, produced, and co-directed a short film called Justifiable Homicide that talked about the dangers of racial profiling. And so from a suburban Black male's perspective, and I was inspired by, unfortunate things that were happening with, Black men and with police and those type of things. And then my younger brother had some negative encounters with police as well in the suburbs where we grew up. So, just I really wanted to create more awareness from a different perspective. And then I produced self-financed pretty much a documentary, My Girl Story. And that was my passion project because it told the story of two African American girls from Detroit fighting to be the young women they want to become. And so one of the girls did have a disability that was in it. So I was very attentive for why, I did that. And when I had different screenings and these, one of the Black young women who had a disability said that I feel seen and heard, so that's why I think, film and, storytelling, all that's important because it creates awareness around the issues that, we face as a community, but then also it creates that representation on what is possible.
Yes, absolutely, absolutely. And in your advocacy and media work, what are examples of inequities you see and have experienced yourself that you feel must be highlighted more and addressed through a disability justice lens? How can storytelling be an important tool?
Yeah. So it can be very much an important tool because it, highlights the inequities that exist in society. It brings attention to them. So if you have films like that was a really great film like Crip Camp, for example, that was on Netflix and it was nominated in 2020 for Best Oscar for documentary. But that tells the story of, the disability advocacy movement, the independent living movement, and how disabled people advocated in the 70s from a camp, for disabled youth. And so all the laws that we see today, as far as with the Americans with Disabilities Act and others that all stem from these kids, that was at a camp and they, changed the world, it's particularly in America. And so, showing the inequities and the history and those things are important, particularly with My Girl Story, that I saw inequities that exist to give people a perspective of what it's like to be a Black girl in Generation Z. That's what they call, young people that's like was born between I think 1998 to like 2012. So, they Generation Z. So giving people a viewpoint of what it's like and and the experiences that they have. So like dealing with like on the internet, that wasn't a thing that I had to experience necessarily growing up in the 90s, but the internet and the fighting that sometimes happen and the recording of those fights that happen and dealing with parents and and not get along with your mother and those battles and things like that. And so that film really highlights the inequities that exist for Black girls and Black girls with disabilities.
It's a very good film, and it is on Tubi and Amazon.
Yeah, Tubi and Amazon Prime.
Okay, so I'm gonna put the name of it in the chat in a few minutes. And again, we'll be sending an email to all of the people that registered with information. And then finally, how would you encourage fellow advocates to use the power of media to call for more inclusive policies to ensure the rights of all people living with disabilities are protected?
Yeah. So luckily, one of the, I guess, the blessings that comes from, social media is that, if you have access, you can tell stories. It's more easier now than it was, back then, 80s and stuff. You have the film and it's very, not, it wasn't so easily accessible to people, but like I said, through social media, through our phone, we can record, things that is happening to us. We can, you take photos. There's so many ways that you can, tell a story. So that's what I recommend is that, people, being vocal about what they see, pick up your phone and record, many films have been shown like at film festivals and, even sometimes nationally, like, through networks or PBS or, there's different, they call like movie apps like Tubi and things like it's really easy to get your, film if you choose to do like a short documentary or such to put it on a platform like Tubi and things like that. There's a lot of people that's looking for material. So I would recommend again just to, pick up your phone, take photos and just begin to tell that story for yourself and for your community so you can use that to create awareness and make change.
Thank you so much, Tamika. And as always, it is such a pleasure talking with you and gaining more insight into your work as a filmmaker. I really appreciate your work. And so this is our panel, everybody. Thank you for staying on. And if you have any questions, I would love for anyone that would like to ask a question, you can raise your hand or put it in the chat. And I see people have been talking in the chat. So anyone with a question they'd like to ask? Let's see. And while you're thinking about it, I see Lady T, I see here you say, what actionable steps globally can we all contribute to awareness and prevention regarding Black women and childbirth disparities in the health arena? And so I know, Tamika, I know you touched on that. If you'd like to add any additional information.
All I can say specifically would be to look into the Momnibus Act. It is a package of 13 bills that are aimed at addressing our maternal mortality and morbidity. Find out if any of those bills are in your state. Call your representatives. You can write them, you can email them, you can write them a letter. Let them know that this is a bill that you want to see passed. We have to support policies that are going to impact our lives. So we have to start making sure that we're putting pressure on our legislators to pass these bills as we get them drafted. I know that we're working on a few more here in Michigan. But yeah, that's where you can begin, and always reach out, figure out who your state rep is, figure out who your senator is for your area. Like, start contacting them, sending them letters. I will have her include, when she emails all the folks, there is an action right now that we are doing here in Michigan around supporting birth workers and the creation of our first birth center here in Michigan. So I will make sure it gets shared. Also, if you're in the area, please write that letter to your legislator. It will be linked in there, and I appreciate that question.
Thank you, Tamika. I see Ruby. Ruby has her hand up. Hi, Ruby.
Hi, everyone. Val, thank you so much for this wonderful opportunity. And definitely, gender-based violence is a huge issue, especially in Africa, where I come from. Just last year, I hosted the first edition gender-based violence campaign during the 14 days campaign. And definitely, there were quite a lot of sensitive issues that did come out from both men and women, because we are now seeing quite trajectory when we are now seeing men being part of victims towards gender-based violence. And I believe with platforms such as these, we are empowering not only our communities, but as well as empowering us as advocates in our community to speak out on what is definitely happening. And of course, one other issue that I have picked up from this conversation is about period poverty. Period poverty is really, really, really an issue in Africa. I am an advocate, especially for rural communities, and this is where you see a lot of injustice happening. Even when we are being told, okay, let us speak to the councillors, let us speak to the senators, let us speak to members of parliament to advocate for these children to be able, like you have, Miss Pamela did mention, like, these products should be available in schools for students to be encouraged to go to school. Remember, these are children that live in impoverished communities that may not even have access to quality education. And when girls are removed from school and already are fighting for that quality education, and remember, these girls do have other tasks. For example, they still have to go in the field, help with the harvest, they still have to go long hours, search for water. So the time they spend in class, including their menstrual cycle, you will find that the education in a month, they only receive about 2 weeks of education, because mostly the menstrual cycle is about a week or so, and some attend even more than that. And like the other speaker did mention, some do have complications in the process, because each menstrual cycle is different, and it is up to us as advocates to make sure that little girls and young girls, especially from poor countries, not only Africa, but we have seen the wars that keep happening, Sudan, Niger, they are girls that are currently being affected with the worst atrocity. Not only war, but humanitarian packages sometimes will not come with sanitary towels. And this is where now we have to talk and amplify our voices, that aid should not just be about food. Aid should be basic needs that each and every girl, woman should be able to access. Thank you so much for allowing me.
Thank you, Ruby. Thank you very much. Really appreciate your words. Thank you for being here. Does anyone else have any questions or comments? Okay. Let's see.
Can I say one more thing, Linda?
Sure.
I just wanted to say that I think that when we hear the word globally, a lot of people panic because it seems so big, right? But we also have technology, right? All we need to do is, like, people don't realize that the small thing you do, which could be a conversation or networking or just any type of communicating can make a change. And we also have social media and we also have these platforms. And so that really, really, really shrinks what globally means. And what that means is we have to keep connecting with each other, try to figure out ways to get in places that are rural. But we do have people that are close to those places too. So let's just utilize the tools that we have, communicate more, support one another, share our stories. Because once we do that, we realize we have more in common than we have different. And I just think globally, we can do this, and this is like the first steps. So thanks again, everybody.
Yes, absolutely, absolutely. And so, there are no more questions or comments. I would love to ask for each of our panelists, if you have a few last words you'd like to share for people to think about as we close. Jamie, is there anything you'd like to share?
The main thing that I would like to share is my gratitude for everyone being here, including the panelists. I learned a lot. I've experienced maternal health problems when I was giving birth to my son. Had a similar problem with the epidural. I was unable to walk for 8 weeks after I gave birth. And I could walk minimally before. And 8 weeks afterwards, I could not walk. That's part of the reason why I use a wheelchair today, because of the epidural. But let's keep talking and sharing our stories. Let's amplify voices of those most impacted by areas of social injustice so that we can close these gaps.
Yes. Thank you, thank you. Sharon, did you have any additional words?
I was just gonna say, thinking outside of the box sometimes is also helpful. At Avalon, we've created holistic services where sitting across from somebody is not ideal, but being open to other ways of healing and helping somebody may be important. So we utilize like Tai Chi, Reiki, and all of those types of things, and massage and so forth. But the other thing that I wanted to say, and that's what agencies can do, right? If you have access to that. But for me, as we talked about mother injustice and things like that, I personally became a doula to work with LGBTQ people and also people who have experienced trauma because of all of the things that we talked about. And never in my wildest dreams did I think I'd be doing that, and I haven't started. I went through training. But I say that to say, stepping outside of your comfort zone and creating other boxes instead of the ones that have already been created is ways that we can change, is ways that we connect. So I just challenge everybody to step outside of the box, do something that you thought was totally uncomfortable. You'd be surprised the impact that it can create and the changes that you can make.
Thank you, thank you. Tamika Jackson?
I just want to say thank you to everyone who was here on the panel with me, especially. I learned so much, and it keeps just reminding me about how connected we all are. And though we have some different problems, they're all connected issues, and our experiences, they matter. We matter. And I just want to say that. And I'm sorry, I got a message. And I want to say that I am going to be putting together events for Black Maternal Health Week, which is April 11th through the 17th this year. And some of them will be virtual, some will be in person. I would love for you guys to come out and join. And Tamika, we don't have to talk about putting together a little film. We have the same name and some of the same interests, and I love that. Thank you again.
Thank you so much. Pamela?
Yes, I just wanted to say thank you, London, for um, making space for these conversations today. This has been a wonderful event and I've enjoyed myself. I've learned a lot. But I would like to say what I really would love and encourage people to do is don't think of periods as a taboo, making sure that those conversations are open and have been heard, folks have been heard in the community. And that as it relates to school-age children, making sure they have access, holding companies accountable for costs, and making sure that they're available as needed. You know, we just all need to work together to address this issue because it's a health related issue.
Yes, indeed. Thank you, Pamela. And Tamika Sitchin-Spruce.
It's the same thing, just, thankful. I'm thankful for this opportunity, to be here with all of you. And I think today really showed, with us telling our stories, how powerful, no other greater example, of how important our telling our stories and, things that we go through. So I'm just, encourage people to, continue to, tell your voice, share, your voice and tell your stories and, to create the change that we want to see.
Thank you. That's a beautiful way to end our panel today. I want to thank you all for being here. Tamika Jackson, Tamika Sitchin-Spruce, Pamela Alexander, Jamie Jr., Sharon Fincher, thank you for your expertise. Thank you for your work. And we will be working together again soon. I want to thank our participants for being here, and we'll be sending out follow-up information. Enjoy the rest of your day. Continue on with CSW, and thank you. Thank you very much.